Vitor, thank you so much for taking the time with me. I'm really excited about what you're building at Sami.
Thank you, Logan. Very nice to be here.
So with this company, you're really rethinking healthcare delivery, particularly healthcare insurance, for the Brazilian population. So just to start, big picture, give us an overview of the Brazilian healthcare system as it stands.
Perfect. Brazil is a country of 210 million people, so one of the largest countries in the world. The second largest private healthcare market worldwide, only behind the US, but we grow 20% per year, so growing fast. And it's very similar to the US when you think of private health insurance. Most of the plans are employer-sponsored plans, which means people are buying plans for the employees, and it's expensive, and it's unaffordable, and 80% of the Brazilians don't have access to private health insurance. So we have a universal health system like an NHS, but for 160 million people without insurance, it's not enough. So there are like long waiting lines. You wait for 6 months or a year to get a procedure. So everyone that can afford a plan would buy a health insurance. The thing is, it's unaffordable. So the big issue, the big moonshot, as you guys call it, that we are tackling is affordability. And healthcare is hard. Healthcare is costly. So we have looked in different places. What's the best thing about every different healthcare system worldwide, and a lot of them in the US, and how we could bring something new and build something from scratch. And I believe there are a lot of advantages over incumbents when you're building from scratch, because you can use new technologies, correct the incentives from the beginning, and it's working. So I'm happy.
You know, one thing that really interested me when I heard your story initially was your background and your collection of experiences and how they led you to where you are now. You know, my understanding, you were a practicing physician, but then you went and really kind of studied health innovation. You were in Silicon Valley for a time, and you were really exposed to a lot of these new ideas. And then you went back and you ran a trade show organization, right? Which again exposed you to the market. How did that experience lead you to realize that health insurance was a good way to enter into affecting change in health?
Perfect. As I mentioned before, there are a lot of moonshots in healthcare, and all of them are needed. Genomics, data, diabetes, all like critical. The thing is, I really believe affordability is key, because all of them need money. All of the other moonshots need money to be paid for doctors, for hospitals. And the thing is, most people can't pay. 50% of people in the world don't have access to quality healthcare service because they don't want? No, because they can't pay. So I was really looking, and I was running trade shows in Latin America, looking at 400 digital health theses and startups. I was always trying to understand how healthcare could be cheaper, could be better. And the thing is, when you are a startup doing a niche solution, very nice, very cool, very focused, but you have to rely on a big health system, an incumbent, where meetings take like 6 months, where they don't want to pay much because it's a new solution. You're a startup. So it's hard being a startup. It's very hard to be a startup trying to sell to a hospital system or a health system. And I believe this was kind of a dream, like becoming an insurance and having the patients and really owning the relationship with the customers. That's one of the reasons we don't sell through brokers, because we want to take care of the relationship with our members since the very beginning. Since you see one of our ads on Facebook, you are talking to Sami. When you join, you're talking to your care team, and we are going to work for you, to care for you, to call you. That's one of the reasons we are mandatory gatekeeper, because we want to be your option, your best option, and to be affordable. Sometimes we're going to be your only option.
Let's talk about that mandatory gatekeeper piece, because in our previous conversation, that was a piece where you were studying the best of tech-enabled insurance around the world and saying, okay, how can we take that, not just copy it, but improve on it? And I know one of the pieces was having a mandatory gatekeeper. So what is that, and why is it important?
Perfect. think of someone in a PPO plan, or even in Brazil in like PPO-like plan, you open your booklet or access your app. There's a list of cardiologists in Brooklyn or in São Paulo, and you have like their names, you have their license number sometimes, you have their phone number or address, and you are not a doctor, and you have to pick a cardiologist. The name of physician doesn't tell much about quality. The address or the license number either. And you're not a specialist, so you don't know what is the difference between those cardiologists. So it's the worst kind of decision making ever, because it's someone without knowledge making decisions based on little knowledge or no knowledge at all. Yeah. So how can it work? How can it be efficient? But it's the way we choose care every day. And we like to choose care that way, but it's very inefficient and very costly. And when sometimes we go to doctors that have bad incentives, fee for service, bad practice, and it doesn't surprise us that it's costly, because it's inefficient by design. So we understood that. Think of Waze, the app, like the driver's app. Like it's a standard, like it offers you based on data, analytics, experience, other sources of information. This is the path. You can take other path, but it's going to be costly because you're going to spend more oil for your car. It's going to spend more time. The thing is, in healthcare, we share the spendings. It's only just your choice. When you're driving your car, you want to get a different route. That's fine. You are spending more time. You are spending more gasoline in your car, and that's on you. But when we do that kind of choices in healthcare, we are sharing this cost with everyone, and most people can't pay for the cost sharing.
Right. It makes a lot of sense. I understand that in December you had a big raise. Really speaks to the confidence that the people have placed in Sami. I understand it was really kind of a historic raise for a Latin American healthcare company. Is that right?
In 2020, we raised our Series A, $15 million. Was the largest Series A ever for health tech up to the date. In December now, we raised a $20 million convertible, uncapped. I've heard it, even in the US, it's very rare to raise like $20 million uncapped, safe. So I believe, yes, we have trust from the market. We have great investors such as StartUpHealth and others. And that's what we are looking for. Investors that trust in the model, believe healthcare is complex, healthcare is hard, it's like longer run, but there's 7 billion people that need it, so that's it.
So how are you leveraging those funds? What's next for Sami?
We're investing a lot in technology, so we believe technology can replace a lot of inefficiencies we have. We're investing in growth. Healthcare is a numbers game. Insurance is a numbers game. Data needs a lot of numbers and a lot of volume. So we grew 40% per month last year. We were, in January last year, the first company to sell SMB plan fully online ever in Brazilian history. So the person entered the website, upload the documents, use credit card, and bought the plan without talking to anyone. First time ever in Brazil history. And now we are doing, this month, TikTok. TikTok has been awesome results since we launched like last month. So
how are you using TikTok?
We are introducing people to Sami, like telling this is Sami, we are a new plan, why it's good, what is care coordination. So it's a nice and interesting way with video. We don't dance, sometimes we dance, but we don't dance much. We're using videos to introduce people why this plan can be a better choice. The thing in insurance, it's a reputation and credibility business. You want to buy a plan, which usually is expensive, from someone that you trust. That if you have a cancer, they will pay for that. If you have a car accident, they will be cared for that. That they have good doctors in their network. So we need to increase awareness to bring reputation and credibility, so people will choose us over incumbents or us over other things they spend money with.
Vitor, I love what you're doing. Thanks for taking time with me to break it down for me. I'm going to be watching very closely over the next year or two as you keep expanding in Brazil and maybe beyond.
Thank you. Thanks a lot. It's very nice to be here.
Vitor, take care.
Very good.